Hi, everybody. This is Zen Honeycutt of Moms Across America, and I just want to give an update on Child Health Day in our meeting with the Orange County Department of Health. It's called actually the Orange County Healthcare Agency. I asked two of the gentlemen in the elevator on the way up to the meeting how many employees they have, and found out they have 2,500 employees at the Orange County Healthcare Agency. So I'm really curious about what they all do. But what I know is that they have some goals which are really great in alignment with what we're doing. So I was happy to meet with them. They, number one, their top essential public health services right here. If you go to their website, public health services, number one, public health services is to monitor health. Monitor health status to identify community health problems. Number two is to diagnose and investigate health problems and health hazards in the community. We definitely have some health problems and health hazards in the community for them to diagnose and investigate. Number three, to inform, educate, and empower people about health issues. Right up our alley, right? That's what we do. Inform, educate, and empower people about health issues. Number four, mobilize community partnerships to identify and solve problems. So here we are, a community group, right, in their community, and we want to mobilize community partnerships to identify and solve health problems. Number five, develop policies and plans that support individual and community health efforts. Oh boy, we could just go to town on that. What type of policies and plans that would support individual and community health efforts, right? Number six, enforce laws and regulations that protect health and ensure safety. Oh, we would love you to do that, Orange County Healthcare Agency. Develop policies and plans that support individual and community health efforts. Number six, enforce laws and regulations that protect health and ensure safety. And number seven, link people to needed personal health services and assure the provision of health care when otherwise unavailable. Wow, so they help people get health care when it's otherwise unavailable. Really great. Number eight, assure a competent public health and personal health care workforce. Right, competent public health and personal health care workforce. So competent would mean fully knowledgeable about the health risks of things such as toxic chemicals, right? So perhaps a glyphosate training workshop or a pesticide or herbicide workshop. That could be awesome. We could help with something like that. Get some professionals in to do that. Number nine, evaluate effectiveness, accessibility, and quality of personal and population-based health services. Evaluate the effectiveness, accessibility, and quality of personal and population-based health services. So when something's not working, they would definitely acknowledge that, right? They would evaluate it and they would acknowledge that. And I'm sure that they would, number 10, research for new insights and innovative solutions to health problems. So the research that we brought them, which is many pages of bibliography, let's see, probably 50 different studies. Let me see, here we go. Let's see, 4 pages of, so we brought them a partial listing of scientific, of studies and papers documenting harm by glyphosate. So we've got, let's see, page 1, here's page 2, page 3, all kinds of things going on here, celiacs, endocrine disruption, all kinds of chelation, antibiotic, right? And page 4. So these are just some of the studies that we've accumulated. You can get this list on the Facebook page, Take Action for Child Health Day. I've uploaded this document. And this is the titles and the authors. So they can just Google the title and the author, and the journal in which it was published or the website on which it was published will come up. So you don't really need to have, you know, every single, like the website and all that kind of, you could just have them Google this information. So we presented that, and you know, so all of their top 10 essential services of public health are completely in alignment with what we do. And so we were excited to meet with them, and they said to us originally that we should be meeting with the EPA and the vector control and all that. And so we assured them in the very beginning that we have, of course, met with them, and many of us have gone to vector control. Many of us have emailed and called, and I've actually met with the EPA personally twice. So we are going to them as our Orange County Healthcare Agency to help us take care of these. Anyway, I don't want to be too long-winded here, but I just want to let you know that they ended up only being 3 adults. There were a couple people who were sick at the last minute, but the 3 of us focused on 3 different areas. I focused on food and water. We had a gentleman that was a dietitian and a dad who focused on the spraying on landscaping, like parks and streets and sidewalks. And then we had another mom who focused on the aerial spraying and the ground spraying. And we were supposed to have another mom there focusing on vaccines, but she couldn't make it. So I covered that as well. So having 4 of us would have been totally fine. 3 was okay too, because we all had plenty to say. And if we had had 12 people, I think it just would have been too much. I think people wouldn't have felt like they were able to say what they wanted to say. So we had 3 people and 2 kids, and my 2 kids spoke very well. And we had a whole outline of what we were covering. I believe that's also posted on the website. And, I know this takes a lot of preparation and time, right? It took me hours to prepare for this. And I know you all have jobs, and it's not on your radar. So I want to offer what we did in support of what you can do to go to your healthcare agency or your vector control or your board of directors. So each county has an elected, board of supervisors. They're elected. So they really care about your vote and how many people you can get out. So I would look at who are on your board of supervisors for your county, and what are their positions about pesticides or aerial spraying, and find out, because they're running for election now. In fact, on Wednesday here in Mission Viejo, there's a greet and meet of your local city council people. And I'm going to go because I want to know it's either Tuesday or Wednesday. But anyway, maybe it's tomorrow. So I want to know what their position is on pesticide spraying and aerial spraying and vaccines and all of that. I want to know what they are going to do once they get into office. So I really encourage you to get involved on a local level. And what happened at the Orange County Healthcare Agency meeting was very interesting. They agreed with us on many different levels, and where I connected with them was on diabetes, how glyphosate destroys the gut bacteria, and how tryptophan makes serotonin and melatonin, right, or helps the body make that. And if you don't have tryptophan or serotonin is what regulates insulin. So without the ability to regulate insulin, you get diabetes. And they all really perked up about that, because they know that diabetes is a huge epidemic. And it's very big in Santa Ana, in Orange County area, where my pediatrician said she goes to the Santa Ana area where there's a lot of low-income Hispanic kids, and 90% of them are obese and or have diabetes. And that's just a huge burden on their family and on our healthcare budget in Orange County. So they were very concerned about that, and they said they could definitely see us having some partnership or making some headway in that area. Also in the area of obesity and in community gardens. I realized when I went to Detroit, there were 1,500 community gardens there, and 22,000 people volunteered every weekend to work on those community gardens. That's just awesome and amazing. And those kids that are working on those community gardens will eat vegetables because they're growing them. So that's an area that we are sorely lacking, I believe, here in Orange County. When you drive around, you just don't see community gardens along the side of the road. There's I can think of 1 or 2 areas, and then I can think of 3 farms that you see. But we should have community gardens everywhere. I mean, we have a year-round growing season. So that's someplace that we really need to develop in Orange County, and they did agree on that. Now, they did not agree about vaccines. That at least one person didn't. He said that he believes vaccines are a safe and effective way to prevent childhood disease. But I said, even with weed killer in them, and he would not answer me. He just said that he was taking his time to respond to what I had to say. I said what I had to say. Now he's going to say what he needs to say, but he never addressed the weed killer and vaccines thing. that, and the way I presented it, I believe made a lot of sense as far as the whole farming, GMO farming, contaminating it's contaminating the grains. The grains are sprayed with chemicals. The animals eat the grains, and then the animal parts are used in vaccines. So it completely makes sense that our vaccines would be contaminated with this weed killer. So there's no arguing with that. And I just feel like they think they can't do anything about it. So what I am glad, though, is that one of the directors did say that there is real science out there about glyphosate. So, yay! So yeah, she actually held up a study that she had found earlier and she had highlighted, and she knows that there is a real issue with glyphosate. So I was really excited about that. And yeah, the people were great. They were all the right people. I met with we met with the assistant agency director, the deputy agency director of public health services, the deputy of health, I think the offices, the family health medical center director, and the director of environmental health. So that was awesome. Really, really awesome that they made the time to meet with us on Child Health Day, and to hear all of our concerns and to talk about where we could potentially work together. And, I'm very glad. Of course, there's a lot of places we need to get to. They did not agree that bats are necessarily a solution for vector control, because bats have rabies. And, apparently 10 bats had rabies in the past year. And even though one of our people said, yeah, but if you're concerned about cats and dogs getting rabies, they get vaccines, right? So they wouldn't get rabies if they have vaccines. And they said, yeah, well, we're concerned about kids picking up the bats and getting rabies in the park. So I'd be curious to know how many kids actually got rabies this year from picking up a dead bat with rabies in Orange County, versus how many kids got, have mental illness or have autism, and could be being impacted by the spraying of neurotoxins, right, to prevent these mosquitoes, instead of bats, right? How many kids have mental illness in Orange County today? And let's put that number up next to how many kids got rabies, and like died from it or were severely harmed from rabies. I'd be curious, right? As far as I know, the areas that are sprayed with mosquito control, the increase is like 25% higher of kids that have autism in the areas where they're spraying neurotoxins down on the human population. And it's even higher. It's like 60% higher in areas where people farm and they spray, pesticides on a regular basis. The kids around the farms, according to my recollection, it's somewhere around 60% higher rates of autism. So these are numbers that no one can ignore, especially not people in a healthcare agency. And I was very glad to see that they were fully listening. They were fully attentive. There was one man that just kept saying that, this wasn't their jurisdiction and they didn't have the authority to do this and that. But I really pleaded with them because I said, listen, I get that you feel like there's a lot that you can't do, but we're not going to make any progress if we just look at what you can't do or what you're not authorized to do, right? What we need to do is look at what you can do and to look outside the box of what you have been doing, because this is a health crisis and we need you to take action. Frankly, my background is in fashion design and business. I ran my own company. It was in wellness, but it wasn't in pesticides and herbicides. I have no background to be going to Australia and New Zealand and China to be speaking about glyphosate, except for the fact that I've researched the heck out of it because I care about what happens to my kids and the kids in this community, and in our world. And you can do whatever you set your mind to do. You don't have to be authorized to be doing all this stuff. We need to take extraordinary actions here to prevent extraordinary harm from this health crisis that's happening in America. So I urge you to everyone to do what you can. And I know you will not be able to do everything that I'm talking about here. And it may just seem like, whoa, that's just too much for me. I'm glad Zen's doing it. Then that's cool. I got your back. However, I am offering you the outline and the the materials that we presented and the bibliography, the scientific studies, so that if you are so moved, or if you have a friend that can help you, to go meet with your public officials or your city council or your board of supervisors, whoever, and let them know that toxins are poisoning our planet and contaminating our children. They are making our children sick. And this toxic burden has to stop. This era, this chemical era has to end. And they can take one step at a time by putting out statements such as, we as a healthcare agency or as a city council or as a board of directors or whatever are committed to reducing the toxic burden on our children or on our citizens. And here's the 3 steps that we're going to take to do that. For instance, this is just an example. Number 1, discontinuing the use of Roundup 2,4-D, dicamba, and toxic chemicals on our parks, streets, and gardens. Number 2, using alternative methods to aerial spraying and ground spraying for vector control, such as bats, plants, there's electric zappers. I mean, there's many different methods that you can use to reduce and to for mosquito control, right? And number 3 would be to raise awareness about the toxins in vaccines, to support health freedom, health choice. Number 4 would be to encourage organic food at all public events and within the community, so whenever they put out information, it's not just exercise and eat more fruits and vegetables, it's avoid pesticides and herbicides by eating organic as much as possible. Exercise, eat healthy, eat whole organic foods as much as possible, right? So without that information, it's actually not responsible information to be putting out, because there are plenty of people who eat lots of fruits and vegetables and run like crazy. They're runners and they get cancer because they don't know that they're eating soy, which is GMO, which is heavily contaminated with glyphosate, or they're eating lots of potatoes or corn that has glyphosate residues on it and other toxic herbicides, right? So it's not actually truthful or factual to just say eat healthy fruits and vegetables. I mean, eat fruits and vegetables and exercise. That's not telling the whole story. It's not reality. So we need to be advocates. We need to encourage our healthcare agencies, city councils, school boards, all of these people to tell the whole truth, which is that this toxic burden is compromising not just our children, but the future of our nation. And so we need to stand for the future of our nation. And doing so means to reduce the toxic burden on our children and our citizens. So thank you for listening to all this. I know this was a little bit long-winded today, but I wanted to give you an overview of what happened at our meeting. Hope that you'll have a meeting, or at least send this information to your local officials. I really believe we can make a difference. I know it's very depressing what's been happening out there, but I really believe we can make a difference. And with your help, we absolutely can, doing this together. On a side note, we lost 8,000 Twitter followers yesterday. We got a spam attack, we had a snafu, and just 8,000 of our supporters, poof, off Twitter. Really, really devastating. But we love you. We know you love us. And please just follow us again, and tell your friends and family, and maybe hopefully sooner rather than later, we'll have even more than 10,000. At this point, we should have a couple 100,000, right? We've reached so many people across America with your support. So please follow us on Twitter, like us on Facebook, click get notifications on Facebook, and then also go to our website and sign up for our email list. We don't send out tons of emails. We only send out emails where it's really important, like a call to action, things like that. So, and then we would love it if you would be a member. So for only $3 a month, you can be a member of Moms Across America, be a supporting member. And we really appreciate your support to help us keep things going. Okay, thanks a lot. Happy Child Health Day. Call your FDA, the EPA, the CDC, the NIH, and your Department of Health. Please, thank you. Call today.